As you already know, Hendrick has developed a COVID community safety dial. And the purpose of this dial is actually to keep the public up to date with our hospitalizations and ways that we can reduce community spread and to reduce our hospitalizations. There are 6 levels. We have been at level 5 for the last few weeks. And in the last week, we've moved to level 6, which is our highest level. It's our level that's called the emergency level. Level 6 indicates that we have uncontrolled community spread of COVID-19 and that we have been at 7 days consecutive over our 15% required by TSA. Presently, in our community, we have 2,700 active cases. That number is better than what it has been. We've been as high as 3,000. And for the last week, we've been consistently trending down, very slowly, but trending down, which is a good indicator. However, our hospitalizations and our ICU capacity continues to increase.
The biggest restriction that we have on our capacity remains the ICU. Both our campus on the north end of Abilene, the south campus, and the Brownwood campus have seen unprecedented levels of patients requiring critical care. This is something that the hospital has planned for and hoped not to see, but we are seeing it now, and we're implementing the plans that have been laid out since the spring. We've implemented measures to compensate for this increased burden by bringing on folks that the state have provided through the STAR program, as well as drawing on other areas within the hospital system to provide for the needs of the patients that we're seeing. When we take members from other floors, from other service lines to help and care for the patients in the ICU or on these floors with the COVID patients, that means that we have a decreased capability to provide services in areas where those people typically work. That impacts our ability to continue on with things such as elective procedures. We are continuing to perform elective surgeries and have elective procedures proceeding within our hospital, both at this campus, the South Campus, and in Brownwood. But what that requires is for a team of individuals, a group at each campus, to review the daily census, the capacities, the staffing, as well as the schedule for the day ahead. These things are not dictated by a percentage, by being at 15%. It's dictated by the burden on the hospital and on what we're capable of providing for.
At this point, Hendrick has reached out to the state looking for assistance. We've asked for ICU nurses, respiratory therapists, ventilators, and tents. Presently, our regional hospitals right now are at capacity with limited resources. Because of these limitations with their resources and capacity, that means that deaths are going to go up in these communities. The ability for them to transfer into higher levels of care are very limited at this time.
And encourage you to be vigilant and step this up maybe even one more level to make sure that we do trend this curve down so that we can continue to provide the services necessary for folks without COVID, but also deal with the individuals that come in and require such high levels of care.
So our ask is simple. Our request is simple. We're asking you to stay at home. It means canceling all non-essential events. It means rethinking how we do our holidays, how we do our gatherings, how we do Christmas, how we do New Year's Eve and New Year's. It's remembering when we leave the house, we always wear our mask, whether it's into the community or into the businesses. It will take our community being socially accountable to each other. It'll take us being responsible to be able to protect our community and to protect lives.